Okay, let's start. So, good afternoon, everyone. And for those of you who don't know me, my name is Bethan Vaughan, and I'm the TSA Senior Research Manager. A huge thank you for joining us today for this webinar. As you know, this webinar is part of a series of webinars, which are all part of our Research to Real Life campaign. And this campaign is showcasing the new research that the TSA is funding to really address the unmet needs of people affected by TSC. And I just want to say as well a huge thank you for your engagement and your support so far, and a special thank you to everyone who has made a donation to support this campaign. You know, your donations and your support and your engagement, they really make all the difference. And your donations, they really make all of this work possible. They make all of the research possible. So thank you very much. And this project that we are introducing to you today is a project that is led by Professor Joe Bateman at King's College London. And we have the wonderful Leila, who is the PhD student for this part of the project. And this project is using NHS patient records, not only of patients with TSC, but patients who have other conditions like Lamb and Birt-Hogg-Dubé syndrome. But what all of these conditions have in common is that they are all linked to the mTOR pathway. And the project looks to analyse a whole range of information about how these conditions affect patient lives. And it really is to inform better treatments and care across England. So I will hand over now to Professor Joe Bateman. Welcome, Joe. Thank you for being here.
Thank you, Beth. Brilliant. Many thanks for the introduction. Um, do you have the slides?
Yeah, do you want me to share them? Just,
You were going to
just
do everything later. Brilliant.
give give me a sign when you want me to change the.
Yeah, if
Right.
you bring a slide up, then the first one's not so critical, but so yeah, fantastic. Thanks for the introduction. So I am at King's College London, and I'm a professor of molecular neuroscience. And as Beth said, I lead a project which is called the mTOR Pathway Diseases Node. So many of you won't have heard of mTOR before, and mTOR is an important, really important signaling pathway in cells that is related to a group of 14 rare diseases. And TSC is the most common of those 14 diseases, but there are others, as Beth mentioned, like Lamb and Birt-Hogg-Dubé, which are linked to TSC and a number of other diseases. And the idea of this project is really to try to study the diseases as a group for the first time, because they're all linked together, we know, at the molecular level and cellular level. So it's possible that the treatment in TSC might also be effective in a number of other diseases in the group. So as the project you're going to hear about today from Leila is part of this a larger project that we're working on based at King's, that involves these diseases, and we're trying to understand what's causing these diseases and identify potential new treatment targets, and as you'll hear about, trying to study the demographics and more about the patient population of these diseases. So if you go to the next slide, Leila, so we ordered one after that. Yeah. So there's really a list of these different diseases which are part of this group. And obviously today is really focused on TSC, but there's a number of other diseases as well that we're working on. And yeah, so a lot of the work that we're doing involves patients, and we have a panel, some of the panel members are present today, of people who've lived the experience of TSC and some of the other diseases, and they've been fantastic working with us in the node, in the mTOR node. So I'm not going to say much more about it. I think, sorry, on the later on the previous slide, there was a QR code. Yeah, so if you are interested in knowing more about this bigger project that we're doing, this mTOR node, you can scan the QR code there, and that'll take you to the website that gives you more information. Or I'm very happy to, if you want to get in touch with me, I'm sure Beth can provide my email address. So what we're going to hear about today is specifically about this registry that we're developing for TSC and for other diseases in the mTOR pathway. So I'll hand over now to Leila, who's going to tell you about what she's been doing.
So, hi everyone. I'm Leila, and I'm a PhD student working with Joe. I've been doing this for 2.5 years now. So I was a research assistant for 2 years doing this, and then I realised I loved it so much I wanted to continue and do it as a PhD. So still here. Uh, So I'm going to start with talking about the challenges in the pathway to treatment, and then I'll go on to basically explaining all the registry and what we're doing with it. So patients with mTOR pathway diseases such as TSC usually face three major challenges. First, diagnosis can be difficult because these conditions are obviously rare and often present differently between patients. Secondly, treatment options remain limited and there's insufficient evidence to guide clinical decision-making. Third, research is usually hampered by small patient numbers and fragmented data sets. And together, these challenges highlight the need for a coordinated approach to collecting and analysing patient data. So to better address these challenges, the Node is developing the world's first population-based registry for TSC and the other mTOR pathway diseases. The registry will bring together data from multiple sources to create a more complete picture of patients, their healthcare journeys, and their outcomes. So before I talk to you about our work, I'd like to briefly explain what we mean by a disease registry or register. A registry is a secure database that collects and stores important health information about people and with a particular condition. This information can include things like demographic details, diagnosis, treatment, clinical outcomes, and healthcare use, all collected in a secure and governed way. For rare diseases, registries are especially important because individual hospitals or clinics often only see a small number of patients. By bringing together information from across the healthcare system, we can build a much more complete picture of the disease at a national level. This allows us to identify patient populations, understand how common different complications are, and monitor how patients are treated and evaluate long-term healthcare outcomes. So how exactly will the register help you? By bringing together information from across England, the registry gives us a much clearer picture of TSC and the other mTOR pathway diseases that has been more possible than before. Rather than looking at patients from a single hospital or clinic, we can understand the whole population, how many people are affected, how the condition presents, and how often it changes over time. It also helps us identify patient groups more effectively. This is important because it makes it easier to identify patients who may be eligible for research studies or clinical trials, helping to accelerate the development and evaluation of new treatments. The registry can improve diagnosis by recognizing patterns in symptoms, clinical features, and healthcare usage. It has the potential to support earlier and more accurate diagnosis, allowing patients to access specialist care and appropriate treatment sooner. Most importantly, the registry is about improving the lives of people living with TSC. By understanding patient needs, how they're treated, and how the outcomes they may experience, we can identify gaps in care, improve healthcare planning, generate evidence that supports better treatment and better services. Ultimately, every piece of information contributes to a better understanding of TSC and helps us move closer to a more personalised, evidence-based care. So how am I doing this? Our approach is to build this registry in close partnership with the National Disease Registration Service, or NDRS. As part of this project, I'm embedded within NDRS as an NHS employee, which allows me to work directly alongside the team who manages national disease registration. This gives us access to the expertise in securely collecting, linking, and analysing healthcare data, as well as ensuring that everything is carried out under the highest standards of data governance and patient confidentiality.
Could you just slow down a bit, please? Just
slow
down. You're saying it so fast. Please just slow down just a wee bit. Sorry.
No, it's okay, no problem. Okay, sorry, where was I? This gives us access to the expertise in securely collecting, linking, and analysing healthcare data, as well as ensuring that everything is carried out under the highest standards of data governance and patient confidentiality. NDRS already collects information on many rare diseases and cancers across England, providing a strong foundation for this work. However, we also recognise that some of the most detailed information about TSC comes from specialist clinics that care for patients every day. That's why we're also collaborating with specialist TSC and mTOR pathway disease clinics across England. These centres contribute rich clinical information that isn't always available within national data sets, including details that are particularly relevant to understanding TSC. By securely bringing together national registry data with information from these specialist centres, we can validate the data, improve its completeness and accuracy, and build a much more comprehensive picture of TSC. This creates a high-quality resource that not only supports research, but also helps us understand patients, improve healthcare planning, and ultimately work together to build better care and outcomes. So using the registry, we've identified approximately 4,000 patients living with TSC across England. We were then able to look at these patients by analysing factors such as age, sex, ethnicity, and where people live and their levels of social deprivation. This isn't about just describing the population. It helps us understand whether services are reaching everyone who needs them, identify areas where there may be inequalities in access to care, and better plan healthcare services around patient needs. Ultimately, having this information helps ensure that resources, specialist services, and future research are targeted where they can make the greatest difference. The registry also allows us to look beyond the diagnosis of TSC and understand people's wider health. We can identify both health conditions that are directly related to TSC, such as epilepsy, as well as other conditions that people may develop over time. Looking at this complete picture helps us better understand the challenges people with TSC face throughout their lives. It also helps clinicians anticipate patient needs, improve long-term care planning, and identify areas where additional support or monitoring may be beneficial. The registry also includes information on treatments people with TSC receive, including prescription data. This allows us to understand how medications are being used in real-world clinical practice, whether treatment patterns vary across the country, and how these treatments relate to patient healthcare outcomes. By understanding what treatments patients are receiving, we can identify gaps in care, evaluate whether people are accessing recommended therapies, and generate evidence to improve future treatment pathways. An important part of this project has been working directly with specialist TSC clinics across England. So far, we've received data from 9 specialist centres, with 3 more clinics agreeing to contribute. These clinics care for many people with TSC and hold detailed clinical information that complements the national registry. By comparing and linking these datasets, we can validate the information held within NDRS and improve the accuracy of the registry and ensure it reflects the real experiences of patients receiving specialist care. This collaboration is really important because it means the registry is being built with input from clinicians who know TSC best. It gives us a greater confidence that the data is complete and accurate and provides a strong foundation for future research and ultimately improving care. Before I finish, I'd like to acknowledge the many people and organisations who have made this project possible. I'd especially like to thank my supervisors, Professor Joe Bateman, Professor Deb Powell, and Dr. Alexandru Dragan for their guidance and support throughout this project. I'd also like to thank the Rare Disease Research UK, the NIHR and MRC, and of course the Tuberous Sclerosis Association for their funding and support, as well as the collaborators at NDRS and the Rare Disease Collaborative Network with TSC for contributing their work and data expertise. Finally, I'd like to thank the patients and families whose information and participation and their continued support that make this research possible. This work simply wouldn't be possible without the involvement of the TSC community, and we're hopeful that the knowledge gained through this registry will contribute to better understanding, better treatments, and better care for everyone living with TSC. Thank you. Any questions? I'd be happy to answer.
Well, thank you so much, Leila, for such an amazing presentation. It's really exciting work that you're doing over there with Joe. I'm just having a look. We don't have any questions at the minute, but I did have a question. So you said that you've collected data for around 4,000 patients with TSC so far, which is absolutely amazing. I was just wondering, is that kind of in line with what you expected? Did you, I think what I'm trying to say is, there's this estimated, we don't actually know how many people are in the UK with TSC at the moment, and there's always been this very wide range. So it's been something from like 3,000 to 11,000 people with TSC. So is 4,000 kind of roughly what you expected, or are you expecting to have quite a lot more? Yeah, just wanted to hear your thoughts on that, really.
So to clarify where we get the patient numbers from, within NDRS, we use something called HES, which is Hospital Episode Statistic data. So it's mostly inpatient data. There is a bit of outpatient, but the majority is inpatient. Not everyone, obviously, with TSC will have an inpatient visit. So some of those patients are not included. For the fact that it is only inpatient, we're very, very happy with the 4,000. It's quite a large number. What we would be missing in any sort of population, we are then trying to fulfill with the TSC specialist clinic. So anyone we'd be missing with an inpatient visit would hopefully have seen a specialist. So we are expecting potentially a couple more thousand just from the specialist clinics, but from HES, we're very happy with the 4,000. It might not be as high as we probably would have expected of everyone. Maybe you expected closer to 10, like as you've said, between 3 and 11. But for what we can get from HES to get an idea, and we haven't heard all the specialist clinics yet, we're very happy with the number that we have. It is quite high for research like this.
Yeah, that's amazing. I think 4,000 is, yeah, a really good number to have. And I'm just having a look now in the chat. So we've got one question from Marie, and she says, "Thank you, Leila. What are the plans to include the TSC clinics in the other 3 countries of the UK?"
So we are hoping to eventually do the whole of the UK. That is the plan. We're starting with England because that's who NDRS have complete access to. The other devolved nations, they're hoping to get next. And because this is going to be part of the rare register, which is separate to what we're doing, it's part of NDRS's mandate. So the NHS have mandated them to create a rare register. There is a cancer register at the moment, and it's supposed to sort of replicate that. So it's supposed to have all of the rare diseases in it, including TSC. And when the devolved nations are then included, hopefully all of that information will be included in that. So even when I'm finished with my PhD, the research will continue and the data will continue to come in. So it will hopefully get to that stage, but it's still very early days in what we're doing.
Oh, that's brilliant. Thank you. And I had another question. So just about all of the mTOR conditions that you're looking at, are they all rare? And where does TSC, like how rare is TSC in comparison with the other conditions?
So they are all rare. TSC is actually the least rare out of all of them, which is why we've started with it. Also, I'm not sure if everyone's too aware of ICD-10 codes. It's basically how diseases are like sort of categorized within a system. And these codes, every disease has a code. The rarer the disease, the more likely it is to be categorized with other codes. So it makes it harder to find this as condition. So it might be with another 5 other conditions. TSC, luckily, has its own specific code for itself, which means we can separate it from every other one and be sure that we've found specific TSC codes. So that's why we started with TSC for 2 reasons, because it was the largest and because it had an ICD-10 code. So it is the largest out of all of them. Some of our conditions have less than 100 people. So yeah, it is the largest one.
Wow, that's really interesting to know. And just another question from me. My mind has now gone blank. So let's go to the chat, and maybe I'll remember my question when we come back. So Laura's asking, what would success look like for you at the end of your project?
So success would have the register complete. That's the fingers crossed hope. So that would mean including all of the other 13 conditions alongside TSC, and also having gone into more detail into analysing the patient data, so understanding the patient pathway. So using what data we've been able to access and finding out more about the patients that this relates to. So being able to know, for example, when they're diagnosed, how quickly they're treated after that, things along those lines. So that's the idea, is to have a complete picture at the end of it and be able to have papers that will then lead to other papers and hopefully end up with better treatment for everyone.
If I could jump in and add to that, bring it a more broad perspective, I think obviously for us, there are research questions that we're aiming to successfully address. But I think in terms of a broader perspective for this audience, I think what we'd really like to be able to do is provide evidence that could potentially impact policy and government. So to give you a specific example, Leila showed the map of the UK, and because of the way that we're doing this work, we're able to identify precisely down to the postcode level where TSC patients live in England, and where there are concentrations of patients, where there are more sparse populations of patients. So now, if you think about if you live wherever you live in the UK, if you live in the southwest or if you live in the northeast, what's your feeling about the level of treatment that's available for the condition that you have or for your child has or your family member? Do you think that's sufficient? When you talk to other family members of patients or patients across the UK, do you feel like they're getting a better level of service from the NHS than you are? Well, the problem with this very hot spots of good treatment and areas where there isn't so much treatment is we don't currently have any evidence for where TSC patients live. We don't know where they live in the UK. We don't even know how many TSC patients there are. So I think some of the first things that we're planning to publish is where is the geographical distribution of TSC patients in the UK, and that will be, you know, solid hard numbers that we can use as evidence to go, for example, to NHS commissioners to say in this particular area there's a concentration of TSC patients, the provision is not sufficient, so we think something needs to be done about that. And obviously, you know, with those discussions we'd involve the TSC community, and we kind of like to get ideas and input into that. But what we're going to provide is actually hard data that is currently missing. And you can imagine that, you know, for many of the aspects that we talked about, for prescriptions, what sort of conditions, comorbidity TSC patients have, what additional provision do they need, and what's not being provided currently. So I think in a broader perspective, like we like that our research has an impact with the provision that is currently there for TSC patients, and what's lacking will provide the evidence that, you know, might be needed to put more of that provision in place. Thanks.
Thank you, Joe. Yeah, and I think you've actually just answered one of the questions in the chat. So where do you see the register going in the future, and do you see it influencing pathways and policies in the future in rare diseases? So you've sort of already answered that. And just following on from that, you mentioned geographical location. Are you also looking at things like ethnicity as well in that? Yeah, that's really good to hear. So we've got a comment. Oh, sorry, go ahead, Joe.
That's something we very much can look at and are looking at, isn't it, Leila, the ethnicity?
Yeah, no, we have all of the ethnicity data and it's already been analysed.
So unfortunately, we aren't able, you know, it'd be nice to show you some of our preliminary findings, but because of the confidentiality issues surrounding NHS data, we can't at the moment show you any of our results. Unfortunately, we'd love to go. I think it would be really impactful if we could do that, but obviously we will do that in due course, but it has to go through various approval processes, and obviously before publication we'll do that anyway. So yeah, watch this space where we can actually show you some of the really exciting results that we have.
No, that's brilliant. Yeah, and of course, yeah, you're keeping people's data as secure as possible. So yeah, making sure that all of those approvals are in place before you share anything. No, that's really good news. So just going back to the chat, we've got a comment from Marie. So in Wales, we have an excellent service from the TSC clinic in Cardiff. That's really brilliant to hear that. And then Francis is asking a question: is there any facility to link with primary care records, so the data that you already have comes from specialist clinics who may not know about everyone? Yes.
So primary care records, you'd be surprised to know, are very hard to get access to, and NDRS do not have access to primary care records, so we can't get it through them. But we are doing a sort of separate side to the project where we're going to hopefully be able to link with primary care data. So it would be slightly later on in our project, but it is the plan is to link with primary care data and GP data.
That's really exciting to hear. And we've got a question here from Sally. How do you sign up to the register?
So it's not a sign up sort of register. So this is why it's different to your regular register, where you'd have to sign up and then you'd give your data that way. Because this is NHS mandated, we're getting the information directly from the NHS. So you wouldn't have to sign up. It's just as long as your patient records are within NHS, we have them and we'd be able to access them. So there is no register or non-register. However, if you do want to opt out, that is an option, and you just have to go to the NDRS website and you can do that. So if you don't want your information in there, that is also an option.
And just to add to that, so this organisation, the NDRS, they have a whole programme to do this work that we're doing, but for all rare diseases. There's around, depends on how you estimate it and define it, but there's probably around 7,000 different rare diseases. So it's a huge undertaking, but they are making progress with that in England. But for many of these conditions, they aren't able to do what we're doing, and they aren't able to use a code to pull out the patients through NHS records. So they will be really reliant on patients effectively not as such signing up, but more more entering themselves through a website form to say that they have been diagnosed with a particular rare condition, so that NDRS are able to then match up their NHS number, name, date of birth with the records that are within NHS already, and say that this person has a particular rare condition. So there will be a sort of self sign up process for other rare conditions, but the TSC, we should have it reasonably well covered. So if you're being seen by a specialist clinic currently, as Leila said, we're working with those clinics, and the majority have now brought their data into our registry. If you're not with a specialist clinic, then and particularly if you haven't ever had an inpatient stay, then we'll be missing you at the moment. And yeah, I guess that's something to think about in future if that is an issue, how we would identify those patients. That's a good thought. Thanks.
Can I ask a question? It's really great. This data, it's a bit late for us because we're already living with it. But I wonder, will you at all connect it somehow, get information on the medicines that people are taking, the impact that they have, what's working, what's not working, clinical trials, so that it's kind of all this information is in one place and maybe helps the doctors decide better what's working, what's not working?
Yeah, so prescription wise, we do definitely have the prescription data. So that is all sorted. We have the full prescription data on patients. We also are able to get the treatment data. So depending on what surgeries or what things have been on that account. What was the other thing you said? Clinical trials.
Yeah, does this type of database that maybe the neurologist can access as like in UK across what treatments or trials are available, and updating it, what's working or what's not working in real time, maybe to have a better understanding for each patient, what can they have?
So at this stage, we haven't got the access to the clinical trials data or how well the medication's working. On a smaller note, we've been working on like a smaller sort of database of patients and seeing when they started a medication and why they stopped it.
Yeah.
So we are working on that sort of side of it on a smaller case, but hopefully in the future we'll do it on a larger level. But at this stage, it's mainly that we know the prescriptions and the treatments that people have had in hospitals and outside hospital, hopefully.
Thank you.
Yeah, I think then just to follow up, I think related to your question about clinical trials, what's really powerful with this registry information is, we have a defined set of patients, a cohort, you call it, who can be potentially recruited to clinical trials. So, clinical trials, obviously, you need a patient population to do the trial in. But if you don't know who the patients are and where the patients are, you're essentially reliant on charities like the TSA advertising a trial and asking people to sign up. But you might not get a very diverse patient population doing it that way. You might struggle to get a particular subset of patients that you're interested in for the trial. So obviously there's a lot of questions around confidentiality, and at the moment, we wouldn't have permission to contact anyone through our registry, but there is the potential to do that in future if there is a clinical trial, and we knew that within the patients that we'd identified in our registry, there was a particularly interesting set of patients, for example, patients that don't respond to anti-epilepsy medicines. We really want to do a trial in that patient population with a drug that we think might be effective.
I think from our perspective, like, confidentiality doesn't matter as long as there is a treatment that could help us, we don't really care. So.
Well, that I think, yeah, I think that's something that's been very interesting working with the NDRS, because they're huge, they're sort of obsessed with confidentiality, and that's completely understandable. And there's been, many scandals of release of people's data that wasn't permitted and problems with that. But I think particularly you're right, in the rare disease community, that the patients that we've interacted with would be delighted almost if they were contacted by you know, an NHS organisation to say we've identified you through your records as your family member, your child, or you have TSC. We're thinking about a clinical trial, and we think you would be particularly eligible because of these reasons.
That would be really great for
I think
future.
at the moment the NDRS are sort of terrified of that idea because it means identifying patients and then contacting them. But I think particularly in rare disease, it's the opposite is true, that patients would be delighted, you know, that
Wonderful.
there's a potential to have new treatments for those patients they have to live with every day.
Thank you.
Thank you, Sylvia, for your questions, and thank you, Joe, for answering that. So we just got one more comment from Francis. So the Genomic Medicine Services in England are looking to improve access to clinical trials as part of the rare disease clinical function. So hopefully this will improve in the future. This is part of the ambition of the 10-year plan and will be part of the new rare disease framework that should be published in 2027. So thank you, Francis. That's really good to know. And it's now gone 12:30. So just so that we're staying on time, just want to say a huge thank you to Leila and Joe for such an amazing webinar episode, and a big thank you for all the really important work that you are doing, not just for the TSC community, but for so many other people who are affected by an mTOR condition like TSC. And I'm sure I speak for all of us when I say we are really looking forward to seeing how your project grows and develops over the next couple of years. And a big thank you to everyone for attending the webinar today. We will get this up on YouTube, so you can watch it again. If you've got any questions, any comments, any feedback, you can comment on the video in YouTube. But if you want to send them over to the TSA's research team, we can get in touch with Leila and Joe and field any queries that come up. So a big thank you, and I hope you enjoy the rest of your afternoon.
Thanks, Beth. Thanks, everyone, for your support and attention. Bye-bye.
Thank you.
Bye, everyone.